This video provides general information only and is not a substitute for personalized medical advice. Always speak to your GP, diabetes team, or pharmacist before making changes to your medication, diet, or activity levels. So, how long does it actually take to lower your HbA1c? If you've been searching for ways to bring it down quickly, here's the honest answer. HbA1c reflects your average blood glucose over the past 2 to 3 months. That means meaningful reductions cannot happen within a single week. But, and this is the important part, you can start making changes today that will lower your daily blood glucose straight away, and those changes will show up in your HbA1c over the following weeks and months. Let's talk about what those changes actually look like. According to NHS and NICE guidance, better blood glucose control comes down to 3 things: what you eat, how much you move, and, where appropriate, medication. On the dietary side, cutting back on refined carbohydrates and added sugars is one of the most impactful steps you can take. Think white bread, sugary drinks, processed snacks. Swapping these for lower GI foods, increasing your fiber intake, and eating regular balanced meals can begin to improve your blood glucose within days. The NHS Eat Well Guide is a great starting point, and if your needs are more complex, it's worth asking your GP about a referral to a dietitian. Physical activity is equally important. NICE recommends at least 150 minutes of moderate aerobic activity per week, things like brisk walking, cycling, or swimming. Even a short walk after meals can help reduce the blood glucose spike that follows eating. The acute effect on glucose can happen within hours, with HbA1c benefits building over weeks and months. One important note, if you use insulin or a sulfonylurea, speak to your diabetes team before significantly increasing your activity, as this can raise the risk of hypoglycemia. Now, medication. If you've been prescribed medication for type 2 diabetes, it's a key part of your overall plan. Metformin is the first-line medicine used in the UK. It reduces the amount of glucose your liver releases and improves your body's sensitivity to insulin. Take it as directed by your doctor and with food to help reduce any stomach side effects. It typically takes around 8 to 12 weeks to see its full effect on HbA1c. Some people are also prescribed additional medicines, such as SGLT2 inhibitors like empagliflozin or dapagliflozin, or GLP-1 receptor agonists. These may be added if HbA1c remains above your individual target. SGLT2 inhibitors carry an important safety consideration. They can increase the risk of diabetic ketoacidosis, DKA, even when blood glucose appears near normal. Make sure you know the symptoms of DKA, including nausea, vomiting, abdominal pain, and feeling very unwell, and follow NHS and MHRA sick day rules about when to pause these medicines during illness or before surgery. Your diabetes team can walk you through this. On targets, NICE guidance recommends HbA1c is checked every 3 to 6 months until stable. Targets are individualized, typically 48 or 53 millimoles per mole depending on your treatment, so your goal may differ from someone else's. One more thing worth knowing. If treatment is being intensified, particularly with insulin, it's important this is done carefully. Rapidly lowering HbA1c through aggressive treatment can in some cases temporarily worsen a complication called diabetic retinopathy. This is why any significant change in your treatment should always be guided by your healthcare team with appropriate eye screening follow-up. So to recap, HbA1c reflects 2 to 3 months of blood glucose, so meaningful reductions take time, typically 6 to 12 weeks of consistent effort. Dietary changes, physical activity, and medication all play a role, and they work best together. And any changes to your treatment should always be guided by a healthcare professional who knows your full picture. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, give this video a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content.